Substance abuse affects almost 500,000 people here in Houston, and that's by the National Survey on Drug Use and Health. But the Harris Center for Mental Health and IDD, they are helping rebuild people's lives. Now, to tell us more about their work, we're actually joined by Jeffrey Ball from the Harris Center. Thank you so much for joining us today.
Thank you for having me.
Now, you're not only with the Harris Center, but you're also the program director for the Substance Use Disorder Outreach Program.
Correct.
And so I want to get to that in a minute, because I want to let everybody know your story first. It is such a touching and moving story. Can you tell us, how did you wind up at the Harris Center?
It was a long journey, but it all started, I was in management for Fortune 500 company, and I had this spiritual awakening in the midst of transitioning to another job within that company. So in that transition, my spiritual awakening came, and God told me I needed to move on. And it was a $40,000 pay cut, and it didn't matter because my spirituality, my spiritual side of me made me want to do something different.
And how did you learn that something different is helping people with substance use disorders?
Actually, I prayed about it. And when I prayed about it, I opened the syllabus, I looked at all the different curriculums that were offered, and it just spoke to me.
Yeah.
And it's been 10 years later, here I am.
10 years and you're a grad of Houston Community College. That's amazing. Have you doubted that decision?
Never.
Never?
Never.
I love it. So tell me, everybody has kind of a personal connection to their purpose, their why. So what is your why? What's your personal story behind that?
My why, I was a victim of domestic violence within the home. My father was a victim of alcoholism and drug abuse. I mean, drug addiction. And that just led to different violence in the home and disparities within my sister and myself as far as being able to adjust in everyday life. But our mother was a strong pillar, a strong tower, and she always kept us in church, and we always had that spiritual guidance, and that just kept us going in the right direction. And once you have a solid foundation, you just build from that. And
now you're on a mission to change that narrative for people who find themselves in a similar situation. That's amazing.
Yes.
Thank you so much for your work. So now let's go ahead and talk about the outreach program. Tell us, who do you help?
We help people, everyone, anyone that's 14 and up with a substance use disorder. And we also assist with mental health disorders, which are co-occurring disorders. So when we have those going on, we can have our nurse, our psychiatrists, our care coordinators, our psych techs, all adjust to actually be a family for this particular client.
And it's not just adults, you also help kids. Yeah,
yes,
that's beautiful. So let's talk about the program itself. What does that look like? Is it inpatient, outpatient, weekly meetings, monthly meetings?
So we link people to any type of care that they need. If they need recovery, be it NA, AA, if they want to go into inpatient, if they want to do outpatient, we link them to any type of care that they need.
And so how can they get in touch with you to learn more about the Substance Use Disorder Outreach Program?
Here at the Harris Center, we have a few numbers. The Harris Center crisis line is 713-970-7000. A SUDOPS number, which is the Substance Use Disorder Outreach Program, it is 713-970-7441. We also have a crisis suicide hotline that is 988.
So what do you say to people who come to you maybe with a relative or family member or someone close to them that has a substance abuse program? How do you convince them to come to the Harris Center? How do you convince somebody who doesn't believe they have a disorder? How do you get them into the doors?
You have to analyze your life. You actually have to take a step back and say, where do I have a problem? Do I have a problem? Am I not paying attention to the problem I have? Am I not listening to my family members? Because when you have a substance use disorder, you have to make sure you have at least what I call the 4 posts, because it's your safety net. And you have to have a friend, a sponsor, a spiritual advisor, and someone that's just going to be honest with you about what's going on in your life. When you have this, you have to really analyze that. Once you analyze it, say to yourself, hey, if more than one person is telling me the same thing, maybe I need to get some help.
And you have additional resources on your website?
Of course. It's www.theharriscenter.org.
And that's where you'll also find additional information on the outreach program for substance use disorder, or even just to connect on any level when you need help with mental health or IDD. And again, that website is theharriscenter.org.